Thank you for allowing us to provide an update on the India North project. Herbertpur is located in the foothills of the Himalayan mountains in India. It is a remote location in an area with scarce access to medical care.
Many patients who live in the region will travel 6 to 8 hours and then walk another 1 to 2 hours to reach Herbertpur Christian Hospital. Thus, the hospital must be capable of providing for a variety of medical needs, including complex surgical and pediatric care.
We have been thinking about our friends in this area, which is hard hit by COVID-19. While several hospitals in the region closed, Herbertpur Christian Hospital made the decision to remain open and created a separate COVID isolation ward.
They made their own PPE kits in-house, as supplies were either too difficult to acquire or were too costly. They looked after many COVID-positive patients regardless of whether they had the funds to pay for their care or not. They are proud of the fact that not one healthcare staff member contracted COVID while caring for patients. Other than COVID, the hospital continues to have ongoing medical needs. One factor necessary to providing critical hospital care is having an adequate number of nursing staff. They are training local rural youth to become nurses. It costs approximately $1,500 to train one nurse. 30 new nurses will be graduating from this program this year.
A priority item at the hospital is to start up their own blood bank. Currently, someone must travel over an hour each way to obtain blood for a patient's use in hospital. Given they are the only ones providing many complex surgical procedures and see many trauma patients in their ER, it would be beneficial to patient care to have access to a local blood bank. They require funding to set up the infrastructure needed.
Lastly, the hospital's ultrasound machine is aging. Their goal is to replace it to be able to offer this important diagnostic service to this region.
We continue to keep in contact with the medical staff there and keep them in our prayers. Your support will enable them to provide medical care for the poor and marginalized in the region. Thank you.